I would say the most important change in terms of cosmetic dentistry since I graduated in 1992 is probably that we do so much more of it. I think, and therefore we get better at it when you practice these treatments more often on a daily basis. But also, it's a much more personalised start, and it's a more personalised treatment during and afterwards as well, because you have to make sure that the patient is happy with what they're going to get. Sometimes patients will ask, what will they look like? And that's quite a difficult thing to lay down for patients. They're curious because they're spending quite a lot of money, and it's something like their front teeth that they're getting fixed. But I would say that cosmetic dentistry has become better technically, but also has become better in terms of the service that's given to the patients. They certainly are given a lot of time for the appointments, but also they get to meet the technician. If there's any porcelain or even acrylic involved, any materials that are being matched up, they're obviously carefully selected, and therefore, because they get to meet our ceramists or our acrylic technicians, they can either go to the lab or we can get the technicians to come to us, and that makes a huge difference. So you're pretty much assured that you get things right first time when you do it that way. When I graduated, dental implants were not really in vogue. They were very rarely placed in practice in the early 90s. Whereas now, I think you'll find that most of the busy Glasgow practices they'll have somebody there that can place implants, and that obviously is filling spaces without dentures, so that's been popularised hugely. Also, porcelain veneers, people now will come into you and they'll say, this is what I want. I would like my teeth to be whiter, I would like them to be straighter, and I would like all of the staining and the chipped bits to be covered with something that looks very cosmetic. So porcelain is obviously the treatment of choice for some patients, but they need to have all of the right conditions. They need to have good hygiene. They need to be brushing and flossing well. They also need to see a hygienist regularly and look after things. So porcelain isn't for everybody. Sometimes you'll get very, very good results just by using composite bonding or by just a routine scale and polish with the hygienist. So you have to, as I say, give patients all of the options and help them to make the right decisions. In the early 90s, we used to do an awful lot more bridge work on teeth, but when we're removing the enamel to place crowns or bridges, you always advise patients that there's 10%, some research would say 20% risk that there'll be damage to the nerve within the tooth. So that's a treatment that we would often elect not to do. Now, we may do it for the protective purposes to make sure that you keep your teeth for longer if they're very heavily filled, but more often than not now, if there's a space, we'll try not to put the extra pressure on your teeth by doing bridge work. So it's actually the case that there are some treatments that are being deselected, and implants are very much replacing those now.